Hello, welcome to the first psychology video that we're going to make. We're doing chapter 12, treatment and therapy today. We're going to start this. We're here because of the coronavirus. But years from now, hopefully you look back and you watch this video and go, oh my gosh, they overblew that. That wasn't a big deal. We're hoping. So let's get into it. We got a picture here, a vintage picture from the National Archives of hydrotherapy in the 19th century. It was like getting a continuous bath. They would wrap these subjects up, and there was water in there, and it was soothing, and it was supposed to calm them down, which is very different than the treatment that was usually given in the 19th century, where they would literally beat the devil out of people. So let's get into it. The introduction. So difficult thing with psychology is how to tell the difference between good therapy and bad therapy. I mean, obviously, if it cures you, it works, but that's not always so easy. It's not always so black and white that it cures you. Sometimes it makes you feel better. Sometimes it helps a little bit, but you're still having problems. And so that's really a difficult thing to measure, is how good the therapy is. Most people have problems, and they get through problems with time. Loved ones can help out. Some people have their faith. Some people exercise. There's a lot of different ways to cope with all the ups and downs in life that we all deal with. And so sometimes, people need a little bit more. So there's two major approaches to this. There's the chemical or the biomedical side, the biological, where it's usually, administering drugs, or there is psychosurgery or things like that. They can also do some, stimulation of the brain. And then there's the other side is psychotherapy, which is very broad. Kind of goes along with the different perspectives of psychology. There's psychodynamic or psychoanalytic, going back to Freud. We have cognitive approach. You have the behaviorist approach, looking at rewards and punishers, and even the humanist. They're all lumped in together. Many therapists use an eclectic approach, meaning they'll do a little bit of psychodynamic, a little cognitive, you name it. Some patients will have therapy and drugs or biological treatment on top of it. The modern health world alternates between mental disorders being a disease, meaning that you inherited them, you could treat them medically, you can treat them with chemicals, or it's an emotional problem, it needs to be treated with something with the mind. And so it goes back to the whole nature versus nurture kind of thing. Who you are, is it because of your DNA or because of society? So let's look at biological treatments today. That's the primary thing we're looking at. Excuse me. So the question of drugs. Measuring how effective drugs is and the use of drugs for psychology is called psychopharmacology. We're going to have a lot of big words today, and I may not be able to pronounce them correctly, and I'm sorry. So the most common biological treatment is drugs. They have largely freed people from mental hospitals. If you look back at the mid-20th century, people that dealt with major anxiety, major depression, schizophrenia, they were confined to a mental hospital. Mental hospitals are kind of few and far between now, and so that's largely due to the the development of drugs. So antipsychotic drugs. So let's look at psychosis. Is when you hear things, you have delusions, when you see things, and so they're called neuroleptics. They basically dampen the response to irrelevant stimuli. Schizophrenia is caused by excess dopamine, and sometimes everything kind of excites the brain, and that dopamine floods the system, and so this kind of dampens the response to that. Some of the chemicals, the actual names I can't really say, but we have thorazine, very common, Haldol, Clorazil, Risperdal, and then Zyprexa, which is here. You can see some of the pictures here. They treat schizophrenia and other psychoses, and largely they're being used more for non-psychotic disorders, depression, bipolar disorder, or manic depression, they used to call it. And so let's get into a little bit, what do antipsychotic drugs do? They block or reduce the sensitivity of the brain receptors to respond to dopamine. Like I said, they kind of block out the irrelevant stimuli. They reduce agitation, they reduce the delusions, they reduce the hallucinations, all the stuff that causes the schizophrenia and the psychosis that's going on. They do little for the other symptoms, the word salads and things like that, the scrambled thoughts. Like all drugs, there are negative side effects. Muscle rigidity, hand tremors, other involuntary muscle movements, especially in the face. There's newer drugs that cause weight gains, diabetes, strokes, in the elderly, and gynecomastia, which you might have to look that one up, or I'll just tell you that's growing breasts in men, actually, is what that is. Johnson & Johnson actually settled to pay $2.2 billion to Risperdal patients because of the side effects that weren't listed, and so It's always a big issue with drugs. I mean, you see advertisements on television or on the internet all the time about drugs, and they treat, I don't know, dry mouth, and side effects are diarrhea and volcanoes shooting out of your eyes, and you turn into a swan. But hey, I'll just deal with my dry mouth. Many people, even with antipsychotic drugs, cannot live on their own. So antidepressants. Many of these are being actually used for anti-anxiety, OCD, and PTSD now. Monoamine oxidase inhibitors, or MAOIs, not Maui from from Moana. Nardil is one of these. They elevate the levels of norepinephrine in the body and serotonin by blocking the enzyme that deactivates them. We're getting very sciencey here, which is strange for me being a history guy. Tricyclic antidepressants, Elavil. They boost the norepinephrine and serotonin levels by preventing the reuptake. So basically, depression or antidepressant drugs. So people who are depressed or they're down because they have a lack of norepinephrine, serotonin, which is a happy drug in your body. So they're really trying to elevate those as a basic thing that antidepressants do. Selective serotonin reuptake inhibitors, or SSRIs, like Prozac, which is very common. They target serotonin. You have Cymbalta, you have Remeron. They target both neurotransmitters. Basically, they're trying to get more serotonin and norepinephrine in the system to allow the brain to not be down and depressed all the time. They're not addictive, but they do have side effects, including dry mouth, headache, constipation, nausea, restlessness, gastrointestinal problems, weight gain, decreased sexual desire, and other sexual problems. MAOIs actually interact with the chemicals in beer and cheese, which means Wisconsin, they can't do that because that's what their life is. That and the Packers, which everyone knows the Broncos are better. Sorry, Packers fans. Meta-analysis on herbs like St. John's wort shows that it's more effective for mild depression than these other chemicals. Now, for major depression, these work really well. They do affect the metabolism. They interact with half of all prescribed drugs. And so there are drawbacks to antidepressants. Even though they're not addictive, they do have major side effects. Tranquilizers, also known as anti-anxiety drugs. The body's too excited. Now we have to calm it down. They increase the activity of gamma aminobutyric, or GABA, not GABA. You can tell I had little kids when I made this because GABA. My bad. Valium, Xanax, Ativan. They're designed for mild anxiety. They may help with panic disorders. They just kind of calm things down. They tranquilize. When you have tranquility, you're at peace is what they do. They're not designed for long-term treatment. They can be addictive. Many people take Xanax. They pop a Xanax whenever they feel agitated, and it becomes a behavioral addiction and a biological addiction as well. Symptoms often return as soon as the medication is stopped, and so there are problems with the anti-anxiety tranquilizers. Going back, lithium carbonate. This is a salt that used to be used for bipolar or manic depression disorder. Moderates levels of norepinephrine by protecting the brain cells from being overstimulated by glutamate. Now, lithium, if you grew up in the 90s, you know Nirvana and the song Lithium. That's just why we have Kurt Cobain here, who suffered from major depression, not bipolar disorder. Well, maybe it was. People need exactly the right dose. It has to be fully monitored. It's very difficult to do that. And so you have to be in a medical facility, and doctors have to monitor how much lithium carbonate they're going to give you. And so it can't be one that you can just kind of do on your own. Some cautions about drug treatments. The placebo effect. We've talked about it in psychology quite a bit. People respond positively. Basically, they think they're getting something done. They're doing something about it. And so the placebo kicks in, and their brain can actually make them feel better. There's the enthusiasm surrounding it. There's their own expectations. The placebo effects will decline with time, though, because it kind of becomes a routine, and it's not that newness to it. The psychological expectation of improvement actually produces some of the same brain changes that the medication causes. So there's actually chemical changes in the brain, is basically what it's saying, by taking a placebo. Not that they know it's a placebo. There can be the opposite. There's something called a nocebo, where you believe it's going to do bad to you, and so it make you feel worse. Like when they gave the experiment to people, they gave non-alcoholic beer to people, and they acted drunk. That's a nocebo. There's a high dropout rate and relapse rates. Drugs have short-term success. The side effects, half to 2/3 of people stop taking drugs because of the side effects, and they're too much. There's the dosage problem. It's hard to find a therapeutic window where it's not too much, it's not too little. We call it the Goldilocks zone, to make sure you get the right dosage, which is very difficult when you have different sized people, men and women, different ages, different metabolisms. And so it's very difficult to get the right amount. They found that Americans were getting 10 times as much of the dosage for the drugs of schizophrenia than that was given in China. Not that Americans can stand more of it, it's just being overprescribed and things like that. Here's a little joke about side effects. It causes dry mouth, dizziness, cramps, rashes, impotence, stroke, VD, bad credit, fever, memory loss, anal leakage, oh boy, joint pain, ill-fitting shoes, heart attack. I'll just live with my itchy eyes. Unknown long-term rest. Drugs are rushed out by the FDA and the medical community because there's big money involved. They're not, I shouldn't say rushed out, but they're treated, but they don't know the long-term effects of what I should say. They do go through pretty tough, rigorous treatment or testing for double-blind studies and things like that. Paxil had 9 unpublished studies that showed that the drug tripled the rate of suicidal thoughts. And those were suppressed largely because they wanted to get that drug out to make money for big pharmaceutical companies. It was only tested a few hundred people for a few weeks or a few months, and so it's not the long term. Nobody really knows what these drugs would do if you take them for 20 years or 30 years or stuff like that. People are now creating cocktails where they're mixing Xanax and Prozac and Ritalin and Risperdal. If you do that, I don't know, that's a really bad idea. Don't do that. It's easier for insurance companies. It's easier to just buy a bottle of pills for someone than weeks and weeks and weeks of therapy that they have to go in all the time. It's easier to take pills than to go for an hour or two of therapy and sit down and really examine what's going on in your life. Doctors can prescribe drugs from other conditions once the FDA has approved it. So even if it's an anti-anxiety drug, they can prescribe for depression. Doctors sometimes get kickbacks as well for prescribing drugs, and there's incentives for them to kind of push this out from the drug companies. Changing behavior and thoughts shows the same changes in the brains as drugs. It's just more difficult. In America, we like things fast and easy. You just pop a pill. Going the extreme route, you have direct brain intervention. Psychosurgery is designed to destroy the areas of the brain that thought to be responsible for disorders. Now, this is notorious, but it still happens today. They'll remove parts of the brain, tiny little bits, not like in the 40s and 50s what they did here. In 1935, Antonio Egas Moniz performed the first prefrontal lobotomy, where they removed the prefrontal cortex, the highest order thinking of the human brain, the kind of the command center of the brain. It was supposed to reduce the emotional symptoms while retaining their cognitive abilities. Sorry, that got cut off a little bit. He won the Nobel Prize for this in 1949. It was never cleared or tested or anything. It just did it. It was never validated scientifically, but tens of thousands of people had a procedure done, very controversial. They'd go in through your eye, a lot of times like here, and remove that prefrontal cortex, and essentially just left people as a vegetable. Some people thought you could stimulate the brain electronically. You have the electroconvulsive therapy, ECT, electroshock therapy, pictured here from the movie One Flew Over the Cuckoo's Nest. It was used to treat severe depression. The current would trigger a seizure, and then the idea that the seizure would shake things out. They used to do for schizophrenia. They would give they would induce a seizure by giving high amounts of insulin. Insulin shocks their seizures, what it would do, and then it would shake. Supposedly, you have the seizure, and it would shake out the schizophrenia. The depression usually returned. The schizophrenia returned after the electroshock or the insulin shock therapy. It didn't work. It doesn't work on other disorders. There's transcranial magnetic stimulation, where they use a magnetic coil near the patient's left frontal prefrontal cortex, and it stimulates it, and actually shows that area is less active in the depressed people, and it works. The procedure does not show memory loss or other side effects. However, it has to be done every day. And who has a transcranial magnetic stimulator in their own home? You have to go into the clinic, and it's very costly, but it is something that's possible. Maybe somebody can patent a home version of it, and we can take care of ourselves at home. That's all I have for today. If you have any questions, let me know. I hope you enjoyed this.